patient. Can I steal somebody? Justin, come on up.
Pull
Sorry,
towards you a
which
little more,
direction are you
Gail.
going?
If you pull it towards you a little more, you can push it back.
Okay, I was gonna get that. I just don't
There
want
you go.
him running into
Yeah, there's.
Huh?
I don't think he's said
Scale
yes.
set, but I just don't know which one. Anterior, posterior.
Scooch toward me. Okay, so this is treating the same thing. So we're still looking to increase posterior rotation here, but we're just going to do it in side lying. And kind of a nice advantage of this is a lot of times we've already gone in to treat the hip, and that way we don't have to fumble people around into a bunch of different positions. So I'll a lot of times just use this and swing around to the other side. So to do this one, we'll oftentimes straighten out the leg, but one thing that I want to think about before I even get to the actual motion here, if I'm looking at trying to increase posterior rotation here, I can affect that at the sacrum by positioning the spine for them. So what I'll a lot of times have them do, take this arm and put it behind you here. And then as I'm here, I can have them right rotated, so I'm taking the sacrum with them. And then we have that position so we can bring that back around the sacrum. Does that make sense? We good with that?
Yes.
Yes, okay. So the actual technique here, straighten out that bottom leg for me a little bit more.
Eric, by doing that, are you increasing or decreasing torque through the sacrum, putting him in that position?
I'm trying to fix the sacrum is what I'm trying to do with it, yeah. So by taking him to the right, I should be taking the sacrum to the right, and then relatively, in relationship to a posterior rotation of the innominate, they should be going in opposite directions then. Okay, make sense? Okay. This works for me. I mean, depending on the size of the person, the size of the therapist, it might not be good for everybody, but I can just set this right on my hip here, on the crease of my hip, and I have pretty good control of him in this position. So as far as the actual technique, I'm going to come right onto the ASIS here. I'm going to hook right along the ischial tube on the other side, and then I can start working in this direction, and then when I want to actually do a thrust, I can have him take a breath in, breathe out, take up the slack, and then hit him there. And that's really just more of a squeezing of the arms.
Since you're right there, would you like to do the muscle energy?
Yeah.
Of that stick?
So, in this position, what I'm going to want to do is I'm actually going to say, I'm going to try and tell him not to let me move his knee down this way. Is that the way you do it? Or are you doing it the other way? Yeah. Because I'm essentially going to try and use the hip flexor here to pull the sacral base forward, is what I'm looking
So
at.
this is treating a,
This will be well, this is almost treating a torsion at this
Yes.
point. So we're looking at
Yes.
treating a left on right,
yeah.
is what we're looking at here. Okay, so the left sacral base being back, I'm going to use the psoas on this side to try and pull that forward while I simultaneously take the innominate posteriorly. Okay? So get him here. Now don't let me bring your leg back down. Good, relax. And again. And relax. Good. And all I'm doing when I'm doing that, I'm just leaning this way. That's it. That's all there is to it.
You're probably leaning down and driving the pelvis in a bit of extension. The lumbar
Yeah,
spine,
well,
a little bit of extension.
Yeah, kind of toward the corner.
You're naturally doing it.
Toward the
yes.
corner of the table that way, so along that line. Okay.
Good. Thank you.